Guys, pure tone audiometry, one of the most important concepts for your exams, vivas, and even in your practice. This is the most basic hearing test. Now, some of the important things here is that this is a subjective hearing test. Okay, so first point is it is a subjective test. What do you mean by subjective? Subjective meaning that it is a test that relies on the patient's inputs. So patient is put in a soundproof room, and the examiner or the audiologist is going to give them different levels of volume and frequency of sound. Decibel hearing level, not decibel hearing loss. Decibel hearing level, dBHL, is this 10, 20, 30, 40, 60. This is the volume. So when we're talking with low volume and going to high volume, that is volume. All right. And hertz is frequency, where we are going from low frequency to high frequency. Frequency is the pitch. Decibel is the volume. A combination of frequency and volume, we are giving sounds to the patient, and patient is asked, can you hear the sound? Patient says yes. He says, when you stop hearing the sound, you let us know. Because the examiner is mapping threshold. It is called threshold. Threshold matlab, what is the minimum one can hear? Pure tone audiometry is a threshold test, which means we are not examining the patient's highest sounds that they can hear. We are examining what is the least that they can hear. Matlab, whatever line we draw over here, if we put any sound above that, they cannot hear. Uska matlab ye hai. We are testing what is the least they can hear. So, if anybody is able to hear in this range from 0 to 30 decibels, generally anybody hearing in this range, that is considered normal. Okay, anything that is in the 20 to 30 decibel range, if you're getting the graph falling there, that is normal. All right. Now, if the hearing is more in the volume or the hearing is more in the frequency, that will tell us different types of hearing losses. Okay. Now, the most complex thing, see, everything can be taught by concepts, but one of the things that students struggle the most with is the symbols. The symbols that we are going to use for this. For that, you have to understand that we will do two types of testings. Okay, so we do what is called as an air conduction testing, and we do what is called as a bone conduction testing. Air conduction testing also, it will be one without masking, and there will be with masking. Similarly, bone conduction will be without masking, and then there will be with masking. Okay, so what is this? Air conduction is our air conduction pathway. Similarly, like when you strike a tuning fork and you place outside, you are checking the air conduction pathway. Air conduction pathway is this. So suppose it's a ear canal, eardrum, 3 ossicles. That is the air conduction pathway. Whereas the bone conduction pathway is the cochlea and the hearing system. This is the bone conduction pathway. If we trigger this directly, so air conduction pathway, the sound is going like this. But in bone conduction pathway, we are directly triggering the skull and thereby triggering the cochlea. That is the bone conduction pathway. So we are testing the air conduction pathway and the bone conduction pathway. So the patient is given a headphone. And headphone ke piche hota hai, there is this place where a probe is also touching the mastoid bone. Now, when the sound is coming directly into the headphone, we are giving air, we are testing the air conduction. That time kya hota hai, the examiner opposite side will start giving some shwee, 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 shwee. So this side is masked. When that is happening, masking is done on the opposite side. Then you are purely just testing that one side of the ear. That is called air conduction with masking of the opposite side. If you don't mask, then here the sound is coming, but here also other sounds person can hear. So sometimes it may interfere with their hearing. So obviously when you mask one side, this side you can exclusively tell ki kitna unka hearing threshold hai. Similarly, bone conduction, you are giving the vibration in the mastoid. And if you mask the other side by giving shwine, 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 then you are only testing bone conduction with masking. If there is no masking, then it's called without masking. So with this, we basically test the entire hearing system. and you have to now understand the logic behind the symbols. You might think that there is no logic behind the symbols. I've seen many students struggling with ये जो symbols हैं pure tone audiometry के, बहुत confusing है. What is the logic? I spoke to one of the most senior audiologists in our country who has written many books, Dr. Anirban Biswas, and he was the one who was able to tell me how this symbols originated, and I'm going to tell it to you. It will become very easy for you. All right. So first, remember that we have the symboling which is very much related to the alphabet. So your alphabet से symbols आते हैं. So there is a right side and then there is a left side. Okay. So there is a right side and the left side. So let's make this blue and let's make this red. Okay. So there is a right side which is red and left side which is blue. Okay. Now how this red came? Because here red ka R is red and blue ka L. Okay. So that is how the symbol of R and L being blue has come. Because red has R and blue has L, they thought right and left, this would be a logical way to give the symboling. Now you see all the symbols will originate from these letters. Now suppose if I were to draw this R little bit differently, like suppose if I were to draw the R like this, right? This is also like an R, but you can see that iske upar wala part becomes a 0 and lower one part can become a triangle. So that is how the symboling has come for, so air conduction, O means no, no means no masking, air conduction without masking. Whereas this is air conduction with masking. The one which is not saying O. O means no without masking, right? And this triangle means close, so it is masking. So that is how from the R, this 0 and the triangle are derived to say without masking, with masking. So L mein kaise karte hain? These are two straight lines, right? So the two straight lines are rearranged into an X. That is air conduction without masking. X means no masking. And you rearrange these four into a square. That is air conduction with masking. So you see how these symbols have basically originated from the letters. The letters have originated from the colors. So show which is right and which is left. Now, bone conduction. Bone conduction is a little bit more easy. Okay, so we have bone conduction without masking. And we have bone conduction with masking. In bone conduction, they basically found out that the whichever side is the bracket opening, that side is the one we are testing. So for example, without masking, they use this symbol. This is opening towards the right side, not pointing to the right side, which is the open side. Like this is the open side. So this is the masking of the right side, bone conduction without masking. Similarly, this is pointing towards the left side, right? So the left side, it is not pointing, the opening side is left side. So this is bone conduction on the left side. And with masking, they use this symbol. Now I remember it as almost like M, right? If you make this like this, looks like an M with masking. So this is how the masking is, symbols are, but you have to see which side it is which is the open end towards. So the right side, this side, so this is open on the right side. So this is the right side masking and without masking symbols. And this is opening towards this side, left side with masking, without masking symbols. Okay. Now there are some more symbols. These are the common ones. Here it is implied that whatever you are doing bone conduction, this is on the mastoid. Okay. This is mastoid. There are other parts also you can do. You can do forehead. So bone conduction you can do on forehead. with masking. Oh, ये तो पूरा ज्यादा इधर तक आ रहा है. So if you do bone conduction of forehead with masking, here the symbols are little different. It is like this and it is like this. Now, how do you remember this? See, your forehead, you have two prominences. You have the right side prominence and you have the left side prominence. So you can place, the probe which is producing bone conduction sound on the right side of the forehead. You will say, why use the forehead? Why not the mastoid? Sometimes people have undergone mastoidectomy. There are surgeries that are done where the mastoid bone is mostly removed, or some implants are there, or for some reason you cannot use the mastoid area. Then how do you test the bone conduction? You have to have an alternate way, and that is the forehead. And forehead has two prominences. There is a right side and the left side. Now, whichever side you are placing the vibrating frequency, that is where. So suppose if you were to draw a face, like let's say if I were to draw an imaginary face like this, the right part of the forehead, if we are testing, then that would be pointing here. Whereas this is the eyes, this is the nose, this is the face. This is the right side of the forehead. Similarly, this is the left side of the forehead. So that is how you remember it. Now, if you are not masking it on either side, then when you are not masking anything on bone conduction, you have to place it central, like we do in Weber's test. We play it vertex. So when you are doing bone conduction of forehead without masking, you are basically just placing it in the middle. So all of these symbols have a particular derivation and you can remember it. Like R ka O means no masking, X means no masking, coming from L. Air conduction with masking, you have a triangle, this is a square. Triangle is coming from lower part of R, square is coming from rearranging the same lines. Similarly, bone conduction mastoid, right side, it is opening towards the right side. With masking, this looks like a mask and also looks like M. So this is opening towards which side? That side it is. If you're doing forehead with masking, you're pointing at which forehead you are placing the vibrating substance. And bone conduction without masking will always be central. One more thing that you have to remember. One more symbol that you have to remember, which is if the patient is not giving a response. Like I told you, this is a subjective test. What if patient को जवाब ही नहीं देना है? How much ever the examiner saying, can you hear, patient is not giving the response. Then there is a particular symbol that you use for no response. On right side, if you put an arrow like this, it means no response given. And left side, if you put an arrow like this, means no response given. किसी भी symbol में if in air conduction में response नहीं दिया, then it becomes like this. Okay? Like this. If bone conduction में response नहीं दिया, then it becomes like this. So anywhere you can put this symbol would mean that the patient did not give that response. So in your MCQs, if any of these symbols are asked, this is an easy way, a logical way, remembering from how it originated, because even the ones who came up with this kind of, symboling system also came in a particular manner, so they can also remember, and it is derived largely from the alphabetical system. All right. So now this is about subjective hearing test, threshold, and you have understood now how all the symbols come. So how is this plotted?